All right, well, welcome everyone to today's webinar. We've got Dr. Shawn Meirovici here speaking about cannabis and sports. So it's going to be really, really exciting. It's going to be an hour long and then a Q&A section afterwards. I personally have been really excited for this topic. I have been watching Dr. Shawn's talks with IHN since he started doing them and have never been able to attend them. So I'm really excited to be here today, especially with a topic that I like even more. So I'm really excited. Hopefully you are too. And just some background on Dr. Shawn before we start, and then I'll pass it over to him and he can tell us a bit more about himself and then go into his topic. So Dr. Shawn Meirovici has been, I believe since 2010, he's been a pioneering force behind the naturopathic treatment of disabling neurological conditions, such as I think TBI, traumatic brain injury, spinal cord injury, multiple sclerosis, stroke. He, I believe, has two practices, primarily operating out of Physiologic, and then he's got a second one, I think, in Erin, Ontario, where he acts as the sole primary care provider.
No longer Erin. No longer in Erin.
Okay, that's okay. Well,
it's okay. I'll amend that.
No problem. All good. And yeah, I think you won Best Naturopathic Doctor in Canada in 2012 from Natural Healthcare. And I know you're one of the first naturopathic doctors as well to educate patients on using medical cannabis and acquiring and access to cannabis for medical purposes license through the referral program you use. And you're also a medical advisor on the Cannabis Cooking Company and frequently asked to lecture on the topic of cannabis for groups and schools. So everyone in your homes, welcome Dr. Shawn Meirovici.
Great, thanks so much for that. Theo, right?
Yeah.
Hi, everyone. Welcome. Thanks for joining. So I'll start off with just a little bit more about myself. So I'm a naturopathic doctor, and that's correct. I've been in practice since 2010. And I work primarily out of a neurological rehab facility in North York, Toronto. I also work, well, it's more consulting now, but for a pediatric integrative clinic called Kid Crew in Midtown Toronto. But it's mostly virtual based now. Lots changed since the pandemic started. So Cannabis and me, we first met, I would say going back about seven or 8 years now, when I started to see, and it was becoming more and more popular for patients to get an access to medical cannabis for medicinal purposes license. So I started to see a shift in my patients going from opioid therapies more to cannabis in control of their neuropathy primarily, because I was dealing with a lot of traumatic brain injury, spinal cord injury. So a lot of neurological conditions with an underlying pain component. Beyond that, these patients also had major sleep disruptions. So the two primary things I was seeing patients using it for, actually I would say three things, was for pain, spasticity, which is a big part of traumatic injuries to the brain and spinal cord, and also for sleep. And so I became really interested in this because patients were literally coming off their opioids. They were at least able to reduce their opioids. And so I gradually started referring patients to a cannabis licensing clinic close to my office called Apollo. And I would say at the peak of it, I was referring probably about 5 to 10 patients a week to Apollo for a cannabis license. Then eventually, when it became legalized for recreational use, that just opened the floodgates, and patients could access cannabis on their own without having a prescription. So that's how I got started with cannabis, and I've been really interested in it ever since. Because, as you know, those of you who've looked into cannabis, it's just a well of information when you start getting into our endocannabinoid system and all the different ways that cannabis can be of help. Cannabis in sports. So this topic today is a little snippet from the cannabis course that I've been teaching now, I think for the past 3 years for IHN. And it's a great little section. It's a near and dear to my heart. I wouldn't call myself an athlete. I'm more of a dirtbag. I'm a rock climber. So yeah, I do kind of push my body hard, but not in the traditional sense. But still, I've been really interested in how cannabis could help me in my sport, because with rock climbing, it takes a real toll on the joints of the shoulders and the hands. I've had multiple injuries. So have used cannabis in some respect for some of those injuries and just to help with recovery and things like that. So we'll be getting into all of that in a bit. This presentation is sort of a compilation of the research and ideas that I've been putting together for the past 2-3 years related to cannabis and sports. So we're going to be going into a little bit of the history and the controversy surrounding cannabis and sport, which is really interesting. We'll get into a little bit of the pharmacology and the physiology of how it all works. And I'll also be sharing some of my hypothesis with regards to cannabis and sport, because it still is kind of a gray area, and I would say it's not a definite sports enhancing drug. So I think there's still a little bit of controversy on whether or not cannabis is truly performance enhancing, but that's for you guys to decide at the end. Okay, so let's start getting into it. Just give me a moment here. I have to share my screen with all of you. All right, so it should only take a minute, because I've been doing this for a few years now. Okay. And Theo, if you're around, I'm going to just hopefully let you tell me if it's coming up for everyone on that end. Okay. So everyone should be able to see the first page of the presentation, Cannabis in Sport. Yeah, looking good?
It looks great, yeah.
Okay, excellent. All right. Let me just center everything on my screen. Okay, perfect. All right, cannabis in sports. So we'll get right into the controversy. So this was one of the first, actually, so we'll talk about the first one, but this was one of the first and maybe the most notable controversy surrounding a top level athlete in cannabis. If anyone's guessing who that is, it is Michael Phelps. And so in February of 2009, and this goes back, I believe it was the Beijing Olympics, Michael Phelps was, there was a photo taken of him smoking cannabis out of a bong. And that caused a huge controversy within the Olympic Committee. And, he was apologizing. And this was right after he had won 8 gold medals in the Beijing Olympics. So he basically had to apologize, because you got to understand, with an athlete of that caliber, he's got all these endorsement deals, and I believe he was on the cover of a cereal box at the time, I forget which one, and they took him off because of this. So at that time, 2009, 2008, 2009, cannabis was still really taboo, right? It wasn't legalized recreationally in Canada yet. So yeah, this was a big no-no. However, what it also did is opened up the discussion amongst people seeing this, who were athletes, looking and kind of seeing a normalization of a top level, like probably the top level athlete at the time uses cannabis. And so that sort of opened up this discussion about athletes and cannabis again. So the research into cannabis and sport goes back to the 70s, and we'll go into that. But this was kind of a real starter for the conversation to take place in the mainstream. Then very recently, we had a whole situation with Sha'Carri Richardson, and this was at the 2020/2021 Tokyo Olympics. So in her qualifying run, and this was the star US runner, right? Female runner. And so she, in her time trials, in her qualifications, after that, she tested positive for THC in a urine sample. And so basically what happens is that if the cannabis consumption takes place outside of competition, there's a 3-month suspension. Now, if the athlete undergoes a cannabis, or no, it's a drug sort of, drug training session or something like that, they'll reduce it to a 1-month suspension. So that's what she got, a 1-month suspension. She actually didn't end up competing in any events in the Olympics, even though she was disqualified from competing in the 100-meter, which was her, she was supposed to win gold medal for that. There was another relay she could have competed in, but she decided just to not compete in that. And so same thing, she had to apologize, but it was also discussed that she was using cannabis because her mother had passed away recently, and it was helping her with some of her anxiety and depression. And so because of that, there's all these cannabis advocate groups who are still contesting the fact that cannabis is not allowed to be used outside of competition for Olympic athletes. And so this is still a hot topic. And actually it went so far as Shikari started questioning, there was, I believe, a Russian figure skater in the Olympics, Kamila Valieva or something. And she had tested positive for, I think it was like a heart medication that was on the anti-doping, like part of the anti-doping WADA illicit drugs to be used, but they didn't suspend her, but she got suspended. So this opened up all bunch of controversies, race things and all that. So that was another Olympic controversy that happened recently. So it's still a very, very hot topic, contested topic in professional sport. So a little bit more of the history. Hold on here, just gotta move this over a bit. Okay, so what's really funny is that, okay, let's go back. So the first controversy in Olympic sport with cannabis, if anyone remembers this, was in the 1998 Olympics in, that was in, I want to say it was in Japan, I think. Nagano, yeah, it was in Nagano. And Canadian snowboarder Ross Rabagliati, he did giant slalom on snowboarding, won the gold medal, and then tested positive for THC. His positive test was 17.8 nanograms per milliliter of THC, and the cutoff was 15 nanograms per milliliter. So just over the cutoff amount that you're allowable to have in the urine. And so what happened was, as you can imagine, 1998, cannabis is still really taboo. So the IOC, the International Olympic Committee, voted 2-3 to strip him of his medals. Then Canada said, hey, wait a second. Cannabis is not on the WADA list for drugs that can't be used by athletes. And WADA stands for the World Anti-Doping Agency. And they agreed. And so they gave him back his medal. Now, very soon after that, a few years after that, WADA actually banned cannabis, probably because of this incident. So it was banned under criteria 2. It was performance enhancing, which, that is a heavy term, and we're going to get into the science of it. Basically, by the end of this, I want you to start thinking about whether you think it is performance enhancing. And then 3, against the spirit of the sport, which is a little bit vague. So in 2011, WADA defended its ban, because it's been contested ever since, of cannabis in the Journal of Sports Medicine. And basically they cited a study that demonstrated marijuana could or has the ability to reduce anxiety. And so there's the study there for your reference if you want to check it out. Next, after that, CBD was removed from the list very recently in 2019. So, we're seeing now that, especially in the States, CBD is not basic government regulated. So anyone can consume CBD. Any manufacturer can put CBD in their products as long as it doesn't have THC. And so WADA, the anti-doping agency, they're very, very much rooted in scientific fact. So they decided to remove CBD from their list. And what they cited as the reason for that, which is I find really interesting, is cannabidiol, which is CBD, is not a cannabimimetic, meaning that it doesn't stimulate endocannabinoid receptors in our body, which is actually true. So they actually really did stay true to the science on that. If you guys end up taking the full course, you'll understand that a little bit better. But cannabidiol, CBD, has effects outside of actually direct effect on our cannabinoid receptors in our body. And so that was the reason for removing it. So let's try and answer this question. Is cannabis performance enhancing? So we're going to go through some of what I've determined to be the best kind of research to explain how cannabis can be performance enhancing in sport. And this goes back to the 1970s. So here we have a few studies we'll take a look at, one from 2006, one from 2011, Cannabis in Sports Medicine Journal, Angela Bryan. So this will be really interesting. We'll get into her epidemiological research, looking at populations and their use of cannabis. And then there's another one very recently from 2021 that goes more into CBD itself, its use in sport. So going back to Stead Ward and Singh, 1975, their little study there, they did a kind of cool study where they tested athletes' vital capacity and grip strength. And they came to the conclusion that it did not increase grip strength. And the science is pretty sound there. If you guys want to check out that study, I'm not sure if I actually put up the abstract in this presentation. I'll have to see that in a sec, but you're welcome to just Google it. And I think it's a free study, so you could check it out. And then this next one from 1986 is cited a lot in cannabis research because it was a really kind of cool, elegant study. Renaud and Cormier in 1986. Basically, they had a bunch of cyclists on stationary bikes, and they cycled at their maximum capacity before and after smoking a joint. So, really easy to understand, controlled. And so, it was a really cool study. And basically, they showed a few interesting things in these cyclists. One is that their maximum exercise performance reduced by 1 minute. So from 16 minutes to 15 minutes. And that was 10 minutes after smoking a joint. So they couldn't keep up max level of performance as long as the non-smokers, but the difference was just a minute. However, it also revealed increased vasodilation. So almost immediately after smoking the joint, they noticed that the athletes had increased vasodilation and bronchodilation. So what they were able to do is have a increased FEV1, which is basically more lung capacity. What was interesting is that the non-smokers, so like the control group who didn't smoke the joint, got similar results, but only after exercising for a few minutes. So the cannabis kind of induced this bronchodilation right off the bat. And so this raises the question, does cannabis have some role to play in better oxygenation of tissues? So this one is the Renaud and Cormier study. So we can look at just some of the key points here. Marijuana-induced tachycardia pre-exercise. So one of the things that's well noted about cannabis, and this is directly in relation to THC levels, is that it can induce an elevated heart rate, which they noticed in these athletes as well. Then you can see here after marijuana, the VO2 and VCO2 were increased above control from 50%. So this was basically the bronchodilation that they show here, FEV1, that's forced expiration volume in 1 second, I think 1 second or 1 minute, not, I think 1 second. That was still present after exercise. So it's kind of independent, this effect that the cannabis has on the athlete, it's independent of exercise, this bronchodilation. This was the a little snippet from the article from 2006, and basically what this one suggested is that it can only indirectly improve performance. So this one is taking a more subjective and abstract view of the performance enhancing qualities of cannabis, whereas the previous research was very, very scientific, using very specific endpoints. But this one suggested that the euphoric effect can reduce anxiety, increasing sociability of a player who's nervous, right? So basically the anxious athlete, before a major athletic event, perhaps they had a fall at the same event or doing the same sort of competition before, and so they had a little bit of that sort of traumatic memory. They were noticing that cannabis can affect that. So from a mental standpoint, so they say in this way, cannabis can be considered as a doping product that calms the mind. Very, very, esoteric stuff coming out of a journal, but we know it to be somewhat true because it does have this anxiolytic and calming effect. I would argue that, in some people and with high enough THC levels, it could actually have the opposite effect, making someone a little bit more skittish and paranoid and anxious. So it's very much dependent on what cannabis they're using and how they're using it. Now, there's definitely some risks to cannabis use in sport. And one of the major ones that's been noted in the journals is in sports involving high velocities and machinery. So definitely cannabis is not something you want to be using when, race car driving, F1, motorcycles, airplane sport, any of that stuff, which is, more common sense than anything. Because, the reasoning behind that is it does alter your perception of risk. So in some sports, like I would argue maybe in rock climbing even, it could be helpful because there's a huge fear component to climbing. And so if you're able to kind of deal with the risk a little bit better, you might climb better. But it can affect coordination, movement, time estimation, things like that. Okay, so a few other studies here. Ashton in the British Journal of Psychiatry 2001, they suggest again that cannabis can decrease anxiety, fear, depression, and tension. So I guess a lot of the mental emotional component of competing. Wagner here, 1989, described cannabis as ergogenic because it could play a role in extinction of fear memories, interfering with learned aversive behaviors. This is what I was talking about the PTSD component in sport. So those of you that have played at high level and have failed know that, that next time you approach the same situation, there's some hesitancy here. Now, for us who are not professional athletes, you get over that. But for a professional athlete, and imagine, that hesitancy, that subconscious anxiety is present there before, your Olympic trial, then it could hinder performance. So they saw that in their study that it could really sort of extinguish this PTSD factor from the athletes. And we've actually seen that in regular medicine too, that cannabis can be used in PTSD. In JAMA, 1996, cannabis could be performance enhancing in sport that require greater concentration. So this was an interesting one. And I believe they looked at goalies in particular in hockey. And they were noticing that there was sort of an increased level of focus in these goalies. They could kind of have this narrow vision of what was going on with cannabis. And so we're going to get into a little bit more of that, because one of my hypotheses on one of the aspects of how cannabis can be viewed as performance enhancing is that it's able to get athletes into the flow state or the zone more easily. Okay. All right, so looking at some more studies here. So 1998, athletes use cannabis for relief of anxiety, stress, and reduce muscle spasm. So this one looked at athletes, and basically, I believe it was a questionnaire. And so they kind of described why they use it, which is great because you learn a lot about why, if you ask the athletes themselves, why are you using it? So mostly for relief of anxiety, which we've talked about, stress and muscle spasm. So this is sort of the first time we're seeing muscle spasm. And in my work, as I mentioned before, with neurological injury, we have a lot of spasticity. And one of the things that cannabis has been well researched for is helping with certain types of spasticity, in particularly with multiple sclerosis. Then in 2006, Sagi et al., athletes used for relaxation, well-being, and better sleep. So this was a big one too, and we'll see this pop up again. I would argue that one of the main reasons a lot of athletes use cannabis is for sleep. So imagine, you have to compete the next day, and you're basically ruminating thoughts and you can't fall asleep. Cannabis can help with that, and that's one of the reasons athletes tend to use cannabis, is to help them sleep better before events. Can decrease anxiety, fear, and depression and tension. So we've seen that a few times now. This was interesting. So in 2002, the IOC, the International Olympic Committee, found that 25% of their positive drug tests were for cannabis. And so that prompted a survey, Lorenz et al., in 2002 of over 1,000 sport university students. So these are university level students competing in amateur sport on cannabis use. And so they're asking them, what do you use cannabis for, and how you use it and who's using it. So what they found was relaxing properties frequently used to enhance. So the relaxing properties were one of the main reasons that these amateur athletes use cannabis. And what was really surprising about the results is that they found the higher level of competition. So athletes that were competing at higher levels were actually using more cannabis than the athletes competing at a more sort of, let's call it everyday exercise level. So we're going to get into now some of Angela Bryan's research, which is really interesting because it asks sort of the question that, is the elephant in the room and has been on a lot of people's minds for decades. And that has to do with motivation and laziness surrounding cannabis. Okay, so basically her question is the stereotype of the lazy, mangy, junk food consuming cannabis user true? Is there any truth to that? And so Angela Bryan, she's a social psychologist, and she wanted to investigate if cannabis put people at risk of lifestyle-related health conditions like obesity. So does that translate cannabis use into these sort of lazy people who overeat and are overweight? But they found in their study evidence to reveal the opposite to be true. So that was really sort of interesting for the researchers. This was a nationwide US study report compared to non-users and cannabis users, and there was a lower prevalence of obesity in the cannabis users. And so let's take a look at that research. So here it is from 2011. And basically, you guys can look at this, but when they adjusted for sex and age, they found that cannabis was associated with a body mass index that was lower. So the authors concluded that the prevalence of obesity is actually lower in cannabis users than in non-users. So what's up with that? Now they have to explain, why is that the case? So they surveyed more than 600 cannabis users living in the US where the drug was legal. And they had questions about exercise habits, other health factors, and 4 out of the 5 respondents said they used cannabis immediately before and after exercise. And those who mixed cannabis and exercise spent more minutes per week exercising than users who did not mix the two, which is really fascinating. I mean, this is like tapping into the underground world of cannabis and sport. Like, who would have thought all these athletes were using cannabis like really close to sport, like time-wise. So you can see this in the 2015. I have the citation there, Sports Medicine Journal. So 70% of respondents who used cannabis before working out said that it made exercising more enjoyable. So that's really interesting. It's not far-fetched at all because, cannabis does have that euphoric effect that most people have heard about and know of. But Brian wanted to know a little bit deeper, what is really going on here? And so she suggested that there are specific chemical interactions at play. What's happening in the brain that's actually causing these athletes to want to use cannabis, and how is it making exercise more enjoyable? So I want everybody to consider the runner's high. So we know of this this aspect of running where after a certain amount of time at a certain intensity, you kind of get into that zone, also known as the runner's high. Now, it was classic. The runner's high was classically believed to be related to endorphin release. However, they did studies where they basically blocked the opioid receptors before exercising, and they could still achieve those states, those runner high states. So basically through this research, they were able to determine that the runner's high wasn't really directly related to endorphins at all. Alternatively, what they did find and what there's evidence for is that the runner's high actually might originate in the endocannabinoid system. So a 2000 study found elevated levels of anandamide, which is one of our primary endocannabinoids. These are cannabinoids we make inside of our body that act on the cannabinoid receptors that we all share. Every living thing on Earth, with the exception of insects, has an endocannabinoid system with specific receptors that cannabis or some of the cannabinoids in cannabis stick into. And so they found that this primary endocannabinoid elevated in people who were running and got runner's high. So after running and cycling in a lab setting. And here is the study showing that. And so you guys can read that. Stationary bike for 50 minutes at 70 to 80% of maximum heart rate. And then they check their endocannabinoid levels. So this is the evidence of exercise activating the endocannabinoid system, which is pretty cool. Yeah, so I had to include a rock climbing picture because that is my sport. So here comes my hypothesis on cannabis and sport. At least one of the ways is that cannabis can bring the athlete into a flow state quicker. So in many sports, especially in rock climbing, I'm sure definitely in running, but I'm sure in many sports, there's this phenomenon of the flow state. We're getting into the zone where athletes feel completely engaged in their performance. They sort of lose perception of time. This is all sort of really noted in the research because the flow state has been researched in athletes for quite a while. So there's this loss of perception of time. There's this very precise concentration, being within the moment, and performing at extremely high levels. And so what I believe is that that feeling, because we're dealing with the same endocannabinoid system here. So that feeling of getting into the zone, which you get in certain types of athletic performance, basically what's needed to get into the zone, and this is actually right from the literature, is to enter a flow state, athletes are deep, intense, singular focus. So there needs to be a deep, intense, singular focus. There needs to be a challenged skill balance. So basically you need sport that is almost that maximum challenge for you without basically becoming impossible. And a high consequence, so risk taking. So basically there has to be a certain element of failure or danger, and there has to be a deep focus. And when athletes get to that zone, it basically stimulates the endocannabinoid system. Now, when someone takes cannabis, I believe that it's sort of artificially stimulating those same receptors. So it almost can put you in that flow state or that zone from the beginning. So from the get-go. So it's almost like a cheat of getting into the zone. Now, definitely there's other aspects to it, like the loss of some coordination, things like that. But I think that's one of the primary reasons that athletes are driven to cannabis, and that cannabis sort of you see a lot of cannabis use in a lot of these risky maximum effort sports, is because it's all stimulating the same receptors. So cannabis may also encourage exercise by aiding recovery. So here's the second part of it. Why this, I guess, part two of why cannabis can be maybe considered performance enhancing. So in Brian's survey, going back to that epidemiological survey, 77% of users says that it helped them with their recovery. Excuse me 1 minute. Always forget how taxing talking for an hour can be on the voice. So it helps with recovery. Now, definitely does, and we'll get into some of this really interesting. And this is one of the main reasons I like cannabis in complementary and alternative medicine, is because it has a huge ability to help modulate recovery after trauma. So cannabis might modulate post-exercise inflammation. So we definitely know that certain cannabinoids, almost all of the cannabinoids, have an anti-inflammatory component to them, with CBD probably being the primary one. So a lot of CBD research, even more so now in the times of COVID, doing a lot of research into CBD because of its ability to suppress certain inflammatory cytokines, inflammatory molecules in the body, like interleukin 6, IL-6, and NF-kappa beta. And we're seeing in COVID that there's sort of this inflammatory storm. So they're actually seeing that CBD can be useful for that. So while THC is less anti-inflammatory than CBD, it may also help manage pain. So I know this from my clinical practice that if you want to treat pain effectively, CBD alone doesn't cut it. THC is pretty necessary to have that analgesic property. Now, if the pain is primarily inflammatory, so inflammation driven, CBD might be enough, but THC really has that analgesic property. So it's almost like CBD is like Advil, anti-inflammatory, and THC is more like Tylenol, which is an analgesic. And the really interesting thing, if you go down the rabbit hole with Tylenol, acetaminophen, is they think acetaminophen works by modulating the endocannabinoid system. Okay, this was a survey of 126 people at Humboldt State University. They reported cannabis increased focus, concentration, mind-body awareness. They also asked if people had negative experiences after combining cannabis and exercise, which is great. The more information we have, the better. So 40% actually reported adverse effects, which included elevated heart rate, which we saw all the way back in Renaud and Commier's article from the 80s, and being too high to continue with their workout. So that's just a dosing thing, right? So cannabis is notoriously difficult to dose. It's a bit of an art because, for instance, when you use cannabis orally, the effects don't come on for like at least an hour, could be up to 2-3 hours in some cases. So it's hard to control that dosage. So definitely a lot of these athletes who are using cannabis on their own, not medically supervised, overdose basically, and they're just too high to work out. Some limitations: there was no non-user control group in this case, and the states that they pulled, Colorado, California, Washington, where cannabis is legal, that's why they pulled them, but they already had higher levels of physical activity. So that's just one compounding factor there. Okay, 2018, researchers at McMaster, so close by. They found 3 good quality studies. So they were doing a systematic review, so the gold standard of research, right? Taking a lot of reviews and putting them together. So they're looking at cannabis effect on athletic performance and what are some of the things they found. And Renaud and Commier was one of the studies they used. So they found 3 trials that were really good, high quality, and its effect on athletic performance. 2 trials had high risk of bias. 1 trial had an unclear risk of bias, but they felt they were good enough to include. The effect of marijuana on outcomes, including heart rate, blood pressure, and exercise duration, remain unclear. Low quality evidence suggests that treatment, sham, and active control groups do not have a significant difference in grip strength. Remember that grip strength one way back in the 70s? Then here's the Renaud and Commier that they're citing here with the FEV1. So really the conclusion from this systematic review is that we still don't know. It remains unclear, which is kind of sort of how it sits now. But there's some interesting developments in cannabis and sport, which we'll get into. So 2 studies had participants exercise before and after smoking cannabis. They looked at areas such as workout time, heart rate, blood pressure. There was either no difference from control or a negative effect. I think I have these studies cited somewhere, but if I don't, I'll find them. The sole positive finding was increased forced exhalation, the amount of air that can be exhaled after taking a deep breath. Oh, I think this is actually Renaud and Commier's. I just kind of cited it a little bit. Cannabis research still met with many obstacles. So there is still obstacles in cannabis research. So scientists are trying to find ways around this, primarily because, and I'm not sure if it's changed in the last year or 2, but you still can't use cannabis on a lot of these university grounds, which is where a lot of this scientific research is happening, right? In universities that are focused in this area of research. So they have to have creative ways of being able to study cannabis, such as using mobile labs outside participants' homes so that they can use their own products because of campus restrictions. So this is really the trend with cannabis research throughout the last century, is that a lot of the research was stunted because of the restrictions around using cannabis. You weren't actually able to use cannabis, so how were they able to study it? It was, it was a class 2 drug. So there was a lot of restriction into the research. So what about CBD? So we started to comment on CBD, but let's look at some of the specific CBD research out there. Okay, so here's a great review on cannabidiol and sports recovery. Now this recover from fatigue, muscle damage. Let me see. I think I take a snippet of this. Yeah. Okay. So they found that a quarter of university athletes reported using cannabis-related products, especially in contact sports like rugby. The user rate of CBD is 28%, increasing with age, reporting pain relief, sleep quality improvements, and perceived benefits. So this was, showing how prevalent the use of CBD is and what they were using it for. So let's talk about, so that's the prevalence of CBD. Now let's talk about inflammation. So we know CBD's capacity to interact with receptors involved in controlling inflammation. So really our cannabinoid receptors, we have many, but the two most studied ones are CB1, cannabinoid receptor 1, and CB2, cannabinoid receptor 2. So we have, that should be anandamide in A2A, I think, and also reducing levels. Oh, no. Controlling inflammation with adenosine A2. Okay, that's I think arachidonyl acid, and reducing levels of some cytokines such as interleukin 1. So this is just showing that CBD can reduce levels of these inflammatory chemicals and compounds circulating in the blood, such as interleukin 1. We saw interleukin 6 as well, tumor necrosis factor alpha, and downregulating overactive immune cells, reducing the impact of collateral inflammatory damage of tissues. So this is really, this citation from this study is a great sort of look into all the different ways that CBD helps to reduce inflammation in the body. And what about sleep? So CBD consumption could stimulate the endocannabinoid system. Remember, we have this whole system. It's basically a system that helps maintain homeostasis in the body. So whenever anything's becoming too elevated in terms of neurological signaling, our endocannabinoid system has a negative feedback loop. So it shuts off basically stuff that's going haywire in the body. So modulating sleep disorders and the sleep-wake cycle. So CBD, cannabis in general, used a lot for sleep. It looks like the research is starting to point to the fact that CBD helps with sleep is not so much it's sedative, it actually potentially a little bit stimulating, but because it really helps with anxiety. So a lot of sleep disruption occurs as a result of anxiety, ruminating thoughts, things, anxious dreams, anxious thoughts, awakening people in the middle of the night, or keeping people awake when they're having trouble initiating sleep. So that's one of definitely the main areas where CBD helps with sleep. Pain. So CBD could inhibit the presynaptic neurotransmitters and neuropeptide release. So a bunch of fancy words here. Basically, this is that feedback loop. So what happens is, I should have included a diagram of how our neurons function, but you guys know there's a synaptic cleft, right? So two neurons don't really touch. It's chemical signals that travel from one to the other. So basically what happens, you have your postsynaptic neuron. So this kind of goes to another part of the body, and then you have your presynaptic neuron. I'm just realizing that you guys probably can't even see me, but I'm holding out my hands. But basically what happens is if that chemical signal is too intense coming out of that presynaptic neuron and stimulating the postsynaptic neuron too much, you get a release of these endocannabinoids to kind of shut off that signal. And it can happen in pain signaling, inflammatory signaling, the immune system. So it has really far-reaching abilities to modulate that whole system. Cognition and mood. So evidence shown that acute and single administration of CBD could have anxiolytic and antidepressive effects. Now, it really does. So CBD in particular, definitely we know for sure in terms of the research that there is some anxiolytic and antidepressive effects with CBD. And it's not necessarily all due to the fact that it interacts with our cannabinoid receptors. It actually has some activation of the 5-HT1A receptor, which is involved in serotonin production and tryptophan and all that stuff. So the same sort of pathways that antidepressants would work on. So some conclusions. So CBD appears to have some properties that could boost exercise recovery as an anti-inflammatory, neuroprotective. We didn't even talk about that, but a lot of the cannabinoids, so THC, CBD, CBG, they found that there is some neuroprotection properties. So it helps to protect the nervous system, primarily as both, helping to keep that intense signaling in balance, and also as an antioxidant. Analgesic, so pain removing, anxiolytic, and a general pain reliever. So that's the question. Is cannabis performance enhancing? I think yes, but I don't think it's a total home run that it's performance enhancing, because remember, a lot of this centers around some of these abstract ideas that we have in sport, like getting into the zone, getting into flow state, anxiety, depression, PTSD surrounding sport. All that we really have seen with clear scientific evidence is that it can relieve inflammation, which is more important in recovery. And it's not like athletes aren't able to take Advil and Tylenol for that matter, for the pain aspect. And we also saw that maybe it increases lung capacity and maybe some vasodilation, but so does exercise. And we saw that some other things, some negative aspects of cannabis in terms of the scientific literature, in terms of grip strength and max performance and things like that. So it's really, I would say that, yeah, perhaps it's performance enhancing for some aspects of performance, and for some athletes that are struggling in very specific areas of performance, where basically there's a large mental, emotional component to it, or there's been an injury that cannabis is helping in the recovery process. So I hope you guys enjoyed that, and that gives you a little bit of food for thought. Again, this is a snippet of the more sort of, or the huge cannabis course that's going to be offered, I believe later this month is when we're starting it. And that's 4 weeks long. So we really do a deep dive into the endocannabinoid system, and using cannabis in clinical practice and what sort of conditions and that sort of thing. All right, so that's the end of the presentation. So let me take this off screen share. Okay, all right, I think I'm back as a talking head.
Amazing. Thank you so much, Shawn. And just before we continue, I want to remind everyone here that for those of you that are here and attended live, we have your emails, and you will be getting your email for your 20% off initial consult with Dr. Shawn. And I believe that doesn't expire, right? So even if they don't come see you immediately, they've got time to come see you.
Yeah,
so
just don't come in like 2030.
Yeah, totally. Yeah, they're gonna want to. They have some time between now and then to become professional athletes.
Yeah, that's right. Yeah.
And then we're also going to be doing the Q&A section shortly as well. But thank you so much, Shawn. That was incredible. It was wonderful to hear. Because you hear all these different opinions and thoughts about it, but you laid it out beautifully, and where it has shown benefits, where it isn't recommended to use. And I know that a lot of practitioners are still, it's really natural, I guess, to feel tentative on incorporating it into practices. So it's really wonderful, to see how it can be incorporated, and how amazingly you laid it out. So yeah, thank you everyone for attending, and we will do the Q&A section. Also before there we go. Before, just want to remind everyone that Shawn did mention his course as well, and so it is beginning on Tuesday, May 3rd. All the information is on our website, so you can check it out there. There'll be information in our newsletters as well. But yeah, it's an incredible course where you get to really dive deep into all this and really get to experience the fullness of Dr. Shawn's knowledge. So thank you so much for attending, everyone. It was wonderful to have you, and we hope to see you at the next webinar.